Hello, my name is Shaquille Terry, and what I'll be doing today is demonstrating a IV insertion and IV therapy. The first thing that I will be doing is I need to verify my physician's orders. After I do that, I need to check for any contraindications for the procedure that's going to be taking place today, as far as which arm I can stick and can't stick to establish IV access. I will next need to check the MAR for any IV meds that's going to be administered to the patient. Check all of the right patient, right route, right time, right dosage, right, I think I said right time already. Right time, right route, right dosage, right patient, right medication, and then you have to go over the other rights as well, which is right to refuse, right documentation, and also the right reason the patient is receiving the medication, as well as the right route and everything that the patient is going to be receiving the medication. Next, I would go into as far as gathering all of my supplies that's going to be needed. So after I gather all of my supplies, check all expiration dates on the supplies and the medications that have already been gathered and compared with the MAR that we have here, physician's orders, and then the patient's MAR here. I will also need to go ahead and perform hand hygiene, as well as I think I said everything already. Okay, after I perform hand hygiene, I will go ahead and make sure that I have after I perform hand hygiene, I will go ahead and perform I would have already performed any dosage calculations that need to be done for the medications that are going to be administered. I will come in the room, talk to the patient. Hi, my name is Shaquille. I will be your nurse today. Today we're going to be performing a venipuncture on you, which is just establishing IV access. It's a physician's order that was placed. Can you tell me your name and date of birth? Okay, and if you have any allergies to any meds, any allergies to latex, any allergies to any iodine, also any allergies to betadine or ChloraPrep. Okay, the next thing that I would do is I would go ahead and don my goggles. And a pair of gloves. After I get all of this on, all right, finish putting my other glove on. I'm going to go ahead and bring this up here and get my IV kit and stuff. All supplies that will be needed. Extra. Okay, first things first, I'm going to go ahead and open my IV kit. The dates and stuff have already been checked on everything. Get my tourniquet out of there. Go ahead and apply my tourniquet. Palpate for a vein. Okay, once the vein is fine, you go ahead and loosen your tourniquet. And go ahead and finish setting up your field. You put your tape there. Go ahead and get my gauze out. Clean side up. Take my Tegaderm and put it here. And then I have my little prep there. Next, I will go ahead and set up my INT. First things first, you're gonna go ahead and loosen that cap. Get any air out of there that's in there. Remove that cap. Bring it up. Get any air out of it. Okay. All the air is now out. I will go ahead and connect this here. And then with it unclamped, we go ahead and get that air out of that tubing. Just like that. All right, now that that part has been established, go ahead and come back here, reapply my tourniquet, and go ahead and clean No, I don't need to apply my tourniquet. I need to go ahead and clean my area. Okay, allow that to dry. While that is drying, all right, go ahead and get this part here open. And go ahead and reapply that tourniquet. Then I'm going to clean that area. I would have already checked for pulses the first time, as well as a pulse the second time that the tourniquet is applied, and I will just go ahead and clean that area one more time. All right, I'm going to loosen this cap up just a tad bit without taking it off. All right, while the tourniquet is applied, we already know where we're going to stick at. Go ahead and check cap. All right. Okay, next thing's next. We're going to go ahead and pull the skin taut. Make sure you anchor that vein. Let the patient know you're getting ready to stick them. I'm getting ready to stick you, okay? So try to stay still for me. All right, make sure that bevel is up and you're at a 10 to 15 degree angle. And then you're going to enter that thing. 1, 2, 3. You're going to enter, you're going to see blood. Once you get that blood return, once you get that blood return, you're not going to let go. You're going to go ahead and I like to put my gauze right here. And while holding there, I will go ahead and hook my INT here. You're going to pull back and flush. You go ahead and clamp that off real quick. Remove tourniquet. You're going to apply it to that bevel there while not applying it to your other area. And you're going to walk that gauze off. That outer paper off. All right. Take your tape here. Go ahead and tear a small piece. And you're going to come underneath here. Come right underneath there. And then once you do that, you can take the other piece and come right on across. Alright. Take another piece of tape here. Making sure you secure it good. You would have your name date, the size of the gauge, and everything apply to that other area. And you're just going to secure that tubing. Leave that on there for a moment. I'm going to go ahead and dispose of all of my trash. into the proper reciprocal, and my gel coat into the sharps. And that's an IV insertion right there. Okay, the next thing that I will be doing, I will be opening and hanging a bag of 500 mLs of normal saline. And I'm going to show you how to properly prime an IV primary tubing and primary IV therapy bag. The first thing you're going to do is check your expiration date and everything to make sure it is within the proper dates. Next, you're going to go ahead and get your IV tubing, get your IV bag open. You're going to go ahead and hang that IV bag. And then we'll go ahead and open up the tubing. You need to make sure that you maintain sterility of your supplies. So once you open this, you go ahead and get that roller clamp closed. You can go ahead and pull this here off. Now, first things first, I'm gonna go ahead and get this tubing primed, okay? Okay, first thing you're gonna do is you're gonna go ahead and pop that there off. Take that right there. Pull this, making sure you only touch the inside. And you're gonna go ahead and spike that bag. There we go. All right, once you spike your bag, you're gonna squeeze to fill your chamber 1/3 to 1/2 full. And then as you release that roller clamp, you're gonna ease on that roller clamp and invert your tubing as you go. You're gonna have a couple ports that you need to make sure that you don't let air bubbles get into. Okay, this right here is your first port. You need to make sure that any air bubbles that's trying to get into that area gets out. You can dump it and make sure you pluck them out there. Because you don't want any air bubbles. Gotta get all those little air bubbles out. All those little air bubbles. And it's okay. You can go real slow. get all those air bubbles out. Make sure you get all these air bubbles out. And then you come into your second port here. Those little couple bubbles just came right on through. It's okay to waste a little bit of it. We almost got the last little bit of air bubbles out. There we go. And that part is done. And we maintained sterility. Of that line. Okay, the next thing that we're going to talk about is programming the pump. Well, first, with this tubing, you make sure that you label your tubing with the change date that it need to be changed at, today's date, the time, and your initials. And you would use one of these, which usually comes in the packet, and you would just label that tubing. Usually you want to put it below this area. You don't want to put it on the chamber or right near the chamber or anywhere near your clip. But as far as programming a pump for your patient, you first want to go ahead and verify the physician's orders, of course. Plug your pump into an outlet. You also will need to ensure that the pump is functioning correctly. You also want to go ahead and cut on your pump. Choose the right, we got to do the full setup. First, when the pump first cut on, it's going to ask you about whether it's a new patient. You're going to click yes for new patient. Is it an adult? Yes for an adult. And then you're going to go through the next steps as far as clicking your channel. Once you click your channel and select that channel that you're going to be using, well, first you will need to load your tubing into it. You will load your tubing into it by plugging in this area into the pump first, pulling on this area and letting it slide down in, and then securing it closed. Once that portion is done, you would then select the channel, select primary tubing, and you would go ahead and prime it for the physician's order, which is the patient is going to be getting 500 cc's of normal saline at 75 cc's an hour. So you would program that pump at 75 cc's an hour for your rate, and then you would put for your volume, you want to put it a little bit below, so you probably can put it like at 450 to even it out for the volume, so you'll know when it needs to be changed again. Also, you would want to go ahead and clean the patient's INT hub site with alcohol for 60 seconds. After you do that, you want to flush your INT to make sure that it is patent. But before you flush it, you need to make sure you hold it upright, get the air out of the syringe, and then leave it on there so you'll be following yourself, and take your dead end cap off of your primary tubing and go ahead and unhook that syringe and hook it directly to your INT. And then you could start the rate, make sure that your clamp is completely unclamped. And then you can go ahead and start the patient's medications based on the orders that the doctor provides. All right, for the next portion, we're gonna go ahead and get ready to prime our secondary tubing. You first need to check the date and everything on your secondary tubing, on your secondary tubing, and then your secondary, which would be your medication. And the patient's medication order, you need to verify with the MAR. We're gonna first go ahead and open up this package. Because we would have to prime this tubing. So you first go ahead and hang that patient's medication up there. You go ahead and hang that medication up there. You go ahead and open up our tubing. Making sure we maintain sterility. Go ahead and clamp that close. Now with this one, you have to be a little bit more careful, not to, like if you pull this off, you need to make sure that you're not touching it all over the place with it. So you're gonna go ahead and come up here, pop that there, dispose of it. Go ahead and use your fingers there. Pull that off, making sure that you do not touch the outer side. And you're gonna go ahead and spike that bag. This is the patient's secondary tubing. Once you do that, you can go ahead and squeeze that chamber. And then you're going to ease that clamp open. Making sure you hold it up to not get any air bubbles. Also, you move your clamps on both tubing to make sure that you don't have any air underneath the clamp area. And you try not to let that tubing get away from you. I mean that fluids. Just enough to get the air out of it and clamp it back tightly. I'm gonna hook that to there. Ensure that it does not touch anything. You're gonna also label this tubing as well. After you label your tubing, you're gonna go ahead and make sure you clean your upper Y port for at least 60 seconds. And then you're gonna go ahead and make sure everything is sterile still. You're gonna ease off this end cap, and you're gonna hook it to your upper Y port. Once that is done, you can go ahead and open that clamp completely. Once you open that clamp completely, you're gonna wanna hang your primary tubing below your secondary tubing, and you're gonna go to your pump and go ahead and set on the pump. You're gonna select your pump, choose that secondary infusion option. Once you choose that option, you go ahead and program that pump with that medication order. That medication order is for the patient to receive Kefzol, 475 milligrams diluted in 50 mLs of normal saline, and the minimum infusion time on that medication is 50 minutes. So you're going to let that medication flow. You're going to set your pump for that to flow at 60 mLs an hour, and it will infuse in those 50 minutes. And then you're going to observe the patient for any changes or anything with the medication being administered, and watch the patient. That would be the next thing to do. Once that portion is done, we'll move on to the next step of this process, which is converting the infusion process back to an INT, the patient's back into an INT. Okay, converting your patient's IV med setup back into an INT. You would first need to press hold on your pump. Go ahead and don your goggles. And some new gloves. Once you do that, you go ahead and press hold on the pump. Once you press hold on your pump, you will make sure your clamps are clamped closed. Go ahead and get your new syringe to make sure that you... Not a syringe. Go ahead and get your new flush. With that new flush, if you're not going to be following yourself, you would need to scrub that site for 60 seconds once your IV tubing is removed from your INT. And if you're planning on returning the fluids back to the patient, or reconnecting them back to the fluids and the medications, you need to make sure that you need to put a dead end cap on your IV tubing. You would make sure you get all the air out of your syringe, holding it upright and slightly removing the cap, still maintaining sterility. And then you would make sure that INT site is clean for 60 seconds. And you can go ahead and flush that site to make sure that it's patent. Secure that site. If your facility allows or require you to put any type of the swab caps and hook them to the INTs, you would do that. If not, you would just leave it exposed, and it would just need to be cleaned for 60 seconds again when it's time. Once that is done, you will then secure your INT site, making sure that it's secured down to the patient. Next, we're going to talk about doing an IV push med. You would first need to, of course, verify your MAR, go through all of your rights of administration. Once you do all of that, you would make sure that your INT site is cleaned for 60 seconds. You will also want to get air out of a new syringe. Make sure you get the air out of it, and then you would hook it directly to your INT. You would need to aspirate to make sure that you get a little bit of blood return, and then you will flush it as normal. Right after that, you would unhook this and hook your medication syringe directly to your INT. Once that portion is done, you would need to check. You would need to watch this. You would need to give the medication over the time frame that it is required to be given over, and the patient will receive a 40 milligram IV push of furosemide. With that furosemide, it is 4 mLs total. So it's 10 milligrams per ml for that patient. You would need to watch that patient for any reactions once that medication is given. You would also need to look at the site for any swelling that's on the site, and watch while you're giving the medication over the time frame that it's supposed to be pushed at. The next thing that we will do is we will do reconnecting the tubing. So when reconnecting your tubing back to your patient, you will need to clean the site for 60 seconds at least, and make sure that this site, the tubing is still sterile. You will need to hook it back to your patient, but before doing that, you need to make sure that the line is patent by following the same flush procedure, getting the air out of the flush, holding it upright, getting the air out of it, cleaning the site for 60 seconds, flushing the line, aspirating and flushing the line, making sure that it's patent, and then you would follow yourself and hook your IV tubing back to that, and then you would go back to your pump. You would cut your pump back on. Once you cut the pump back on, you would go through the process of whether it's a new patient or anything of that sort. New patient, adult. You would not do new patient. You would do no for new patient, and then you would do still choose adult. You would select the channel that it is connected to. Once you select that channel, it will give you the option at the bottom to restore the other settings that were already on there. So you would go based off of those settings and go ahead and restart your patient's medications. If you were to be giving an IV push med via the IV tubing or medications that were currently going as far as fluids, you would follow the same procedure that you followed with doing an IV push INT med. You would just need to hold on the pump. You would also need to clamp that line above the bottom Y port, and then you would clamp it off and administer the med over the time frame that it needs to be administered over, following all of the same procedures. And then you would make sure you clean those port sites before you do any of that. And then the final thing that we're going to do is we're going to DC an IV. You would first need to go ahead and don your gloves and goggles. Once you don your gloves and goggles, you would then go ahead and approach your patient, let the patient know that you're going to be DCing or discontinuing their IV access. So you would need to make sure that you have already gathered all supplies. You would then cut that off. You would then go ahead and make sure you have all of your supplies. I have on gloves. You don't need to flush the line because you're DCing the IV. So you would come up to your patient, let them know what you're doing. You're going to first go ahead and make sure you get the tape off. I'm taking this tape off, okay? Make sure you have your gauze clean side up. And once all of your tape is bundled up, you would then need to, as soon as you see the catheter exiting the skin, you would then apply firm pressure on the site. Check your tip to make sure that the catheter is still intact and that a piece of it did not come off into the patient's vein. You would dispose of this in a proper reciprocal. Then you would also go ahead, hold that for the proper time frame, and go ahead and apply a bandage. Once that portion is done, you will go ahead and inform your client that that portion is done. You will go ahead and remove your goggles and gloves, wash your hands, and you will need to document. You will need to document that the catheter was DC'd, that it was intact, and you also need to document that if there were any adverse effects or anything, that you would document that it was reported to the physician. And that's going to be the end of this IV therapy skills checkoff. Thank you. My name is Shaquille Terry. Thanks.